Adverse reaction of the drugs have various ill effects. Sometimes it will be causing fever or something. Sometimes uncommon effect also end the life. Let us see about the adverse drugs reactions. So any drugs we are taking, it has a positive or the negative reactions. That is called side effects. Some of the drugs all be having the side effects. Some of them will be the drug intolerance. Some of them will have a toxicity. So why the nurses has to very important to know the adverse effect. For example, one person is taking whenever the person is coming for the surgery, he may be a drug addict, maybe morphine, pethidine he is taking. So when the nurse has to collect the history correctly, otherwise what will happen? If the anesthetic is not corrected, the patient will be go for the respiratory depression. The anesthesia side effects will be affecting him. So the morphine, pethidine or some of the drug addicts are prohibited to take some anesthetic drugs. So some of the criteria and protocols are there. So the history collection is very very important before you are administering drugs to avoid the adverse reactions. So in this class we will see about what are all the main adverse reactions of the drugs. Main side effects. Side effects is example hypoglycemia due to insulin. So they will take insulin and they will go for hypoglycemia without food. Toxic effect, morphine, maybe respiratory depression. One of the film actor has come. She told the wrong history. Doctor has been given anesthesia. Not recovered. After recovery, she's telling, yeah, I used to take some of kanja and something and all I used to take. So when you collect the history is very, very important. You have to explain to the patients, you please sell, otherwise this anesthesia will be having a complications. Sometimes drug intolerance. Sometime intolerance. One of my friend is taking citrazine every half an hour once, like taking citrazine. For me, if I take one citrazine, nearly 2 days I will be feel very drowsy. I couldn't tolerate that drug. So so the intolerance also. Some people will have allergic reaction. When I was working in a immunization in a Saudi Arabia, suddenly when I give MMR vaccine, suddenly the child went into unconscious. Suddenly it's collapsed. So immediately some of the drugs will be having the allergic reaction. So when you are collecting history, you have to ask, and you should have atropine ready, oxygen cylinder was ready. So I immediately called the doctor, activated code blue. By the time the child was okay. So you have to see allergic reaction. So what are all the kind of allergic reaction is there? Like anaphylactic shock, cytolytic, and then type 2 will be the arthritis reactions will be there. Sometimes the delayed hypersensitivity. Some people will have a skin allergy. The drug side effects will be skin allergy will be there. Delayed hypersensitivity. My father now is telling my leg is swollen. He was so upset, maybe some cardiovascular disease. Once he went to the doctor, doctor told, okay, you cut this tablet, your swelling will be reduced. So some of the drugs will be going, and sometimes it will be your reactions or the delayed reactions will be mislead into the another diagnosis. So that's why you are patients, you have to give a health education to the patients, which kind of, after taking drugs, first you have to check. It's not like a secondary diagnosis or wrong diagnosis and start with the wrong treatment to the patients, and we immediately find out what kind of a drug allergy. And then drug dependence. Some people will be compulsive use of drugs. For example, when I sleep, simply I want Vicks. Simply I would like to be, no headache, but we are every day going to the bed to feel like putting one Vicks to the head. No headache, but it's compulsory to use the drugs every day. So it's like a compulsive drug usage, and will be tetragenicity. It's like a drug causes the fetal abnormality. Of course, some of the drugs will be causing. For example, when the Muslim patients is coming for the Umrah, 101 time I will be asking them, Madam, are you pregnant? Are you pregnant? Why? No, madam, not pregnant. After 3 months, your sister gave measles vaccine, but I am pregnant. So what will happen? So some of the drugs will be affecting the baby. They will cross the placental route and bring the fetal abnormality. So it is a nurse's role to what kind of a drugs you are giving. Check the BP before giving digoxin. So, and then carcinogenicity. So mutagenicity. Some of the drugs, radioactive substances may cause them this one. Some of the hepatotoxicity will be there. Sometimes will be radioactive isotopes will be having the carcinogenic effects. Some of the drugs. For example, For example, if you take so much amount of the like OCD, like oral contraceptive pills, maybe the studies saying that those kind of people who are taking oral contraceptives more than 5 to 6 years, they have the more prone to get the breast cancer. So it is very dangerous. Then will be another one, paracetamol. More tend to take everything, body pain, headache, over the counter dose. You can take paracetamol, combination drugs, and in a so many names, generical name it is coming. So what will happen? Ultimately, it will bring a hepatotoxicity, nephrotoxicity. Some of the analgesic will be causing the nephrotoxicity, and then will be osteotoxicity, furosemide, diuretics, and the ocular toxicity, ethambutol, and ethambutol will be ocular toxicity, GI disorders, opioids, and cardiovascular toxicity diseases. For the digoxin, respiratory disorder, aspirin it may cause. So musculoskeletal disorder, if you take more amount of the corticosteroid, behavioral toxicity also will come due to the corticosteroids. Neurological disorder, INH, for the DB drugs, and the endocrine toxicity will be oral contraceptives. Dermatological toxicity, doxycycline. Doxycycline mostly they will prescribe, but long cycle, they will give doxycycline. That is also will cause the dermatology. And the hepatological toxicity, the chloramphenicol, and the electrolyte disturbance are causing the diuretics. So, as a nurses, we should know what are all the adverse drug effects. While administering to any drugs to the patients, you should know what all the toxicity effect will be coming. Like as I told you, when I immunization room, what is the remedy? CABA, corrective action and the preventive action. That is called the CABA. See, corrective action and preventive action. So what did I do? Corrective action, immediately I activated the code blue, gave some oxygen, knocked the baby, and immediately atropine. We have a doctor came and immediately while giving oxygen itself, baby was correct. And preventive action, what I have to do? I have to ask the child if there is a fever or anything, skin allergics are there. I am not supposed to give measles vaccine. Like for example, the lady who are going for the like I have to ask 101 time. If not, you send her for the test, urine test, or if you are still this one HCG test you can do, by the blood test you can analyze before giving some of the vaccines that will cross placental route and fetal abnormality it will be causing. So wherever you are posted, this is my experience, wherever you are posted you have to take care of the patients, and you must be aware of what kind of a drugs are causing what kind of a allergic reaction.